Meeting to order. Welcome everybody to, we'll allow the minister to get settled. Meeting 110 of the Standing Committee on Health, and today we welcome the Honorable Jeanette Petitpas-Taylor, Minister of Health. And I just wanted to point out to you, Minister, that we put out a red carpet for you and some flags just to make sure you were welcome. That's for you, for an appreciation for you coming so early in the morning. And along with the Minister, we have from the Canadian Institutes of Health Research, Adrian Mota, Associate Vice President. From the Department of Health, we have Mr. Simon Kennedy, Deputy Minister. From the Canadian Food Inspection Agency, we have Mr. Paul Glover, President. And from Public Health Agency of Canada, we have Dr. Theresa Tam. Welcome back. And just one little small change. The Liberals have asked if they could shorten up their questions a little bit. The first two questions they have are going to be shortened to 5 minutes so that Ms. Sonia could have an opportunity to ask some questions. But they'll still have the same amount of time as before, but now I'll make sure that they keep in line, so. All right. So, well, welcome to the committee. And Minister, if you have an opening statement, we'd be glad to hear from you.
Thank you, sir. Thank you very much, Mr. Chair, and thanks you to each and every one of you for coming in bright and early this morning. I know it's perhaps a bit of an odd time to come in, but we certainly want to make sure that we had the opportunity to respond to some of your questions and to appear for main estimates. Monsieur le Président, membres du Comité permanent, bonjour.
Mr. Chairman, members of the committee, thank you very much. Thank you very much for inviting me this morning to discuss the main estimates 2018-19 for the health portfolio and some of our priorities. First, I'd like to congratulate the committee for its work and its accomplishments. Your expert advice on various health issues have been very valued by myself and the government. We're working very, very hard, of course, but your committee is doing an exceptional job.
I first of all wanted to introduce my colleagues, but you've certainly done that already, so I will pass along and continue with my comments. Over the next few minutes, I would like to highlight some of the portfolio's key proposed expenditures for 2018-2019's fiscal year. I would also like to discuss our actions on some of the issues that this committee will address in its work over the coming months. I will then be pleased to take some of your questions. Permettez-moi tout d'abord de vous donner un aperçu.
First of all, allow me to give you an overview of the projects at Health Canada. The department is seeking the authorization to spend $2.2 billion during 2018-19. This funding will allow Health Canada to continue to protect the health and security of the Canadian population. As you know, this budget no longer includes the First Nations Inuit Health Branch. This has been transferred to Indigenous Services Canada. I'd like to outline some of our priorities now, in health, of course, and explain what Health Canada is doing to attain these objectives.
Canada's actions on the opioid crisis. As you all know, this crisis is certainly unprecedented, and the effects are truly heartbreaking. One of the first trips that I made as health minister was to Vancouver, where I toured the downtown east side, visiting treatment centers and supervised consumption sites. It was very moving. So I was proud that our government is taking action. We have restored harm reduction as a key pillar in our strategy. We have approved more than 25 supervised consumption sites and passed the Good Samaritan Drug Overdose Act. We have supported national treatment guidelines for opioid use disorder, and we've made it easier for health professionals to provide access to methadone and prescription-grade heroin as treatment options. Continued federal action, combined with reduced barriers to treatment, will help us mitigate the opioid crisis. Je vais maintenant parler du cannabis.
I'd like to move on now to cannabis. As you know, the government hopes to protect Canadians and limit as much as possible the harmful effects of cannabis consumption. This is why it has tabled the Bill C-45, which is currently under study in the other place. These estimates, we're seeking $65.1 million to implement a federal framework for legalization and strict regulation of cannabis. Together with the regulation framework, the government will base its program on a public awareness in the matters of cannabis, which is, of course, based in public health. We wish to provide Canadians the information they need to make informed and judicious decisions.
Is ensuring that Canadians have access to health care services that they need. That is why that our government is working with provinces and territories to ensure that healthcare systems continue to respond to the needs of Canadians. In the 2018-2019 main estimates, we are requesting $850 million in funding to support provincial and territorial investments in home care and mental health care. As you know, last summer, provincial and territorial governments agreed to a common statement of principles on shared health priorities with the Government of Canada. Now, Health Canada is establishing bilateral agreements with each provinces and territories to determine how they will use federal funding. Included in these estimates to improve access to home care and mental health care services. Nous faisons aussi de grands progrès par rapport à un autre dossier.
We're also making great progress in another file, that of drug insurance. In the main estimates, 2018-19, we're asking for $17.9 million so that prescription drugs and medical devices can be more affordable, more accessible, and be used in a more adequate fashion. This amount will allow us to reinforce the regulation on the price of patented medicines and modernize how we regulate these drugs and medical devices. We want to protect Canadians and the government, insurers, private insurers, against excessive prices of medications, all the while ensuring that patients who need them get them. This project, of course, fits well with the main announcements made in the Budget 2018, the creation of a consultative council on the implementation of a drug insurance regime nationally. Mr. Chair, you tabled in April a report of this committee, Universal Drug Coverage for All Canadians, a Need. I thank you for this, as well as the members of your committee for the extreme work that you did, resulting in this excellent report. I am persuaded and I believe firmly that this will help us with the Council.
Progress made by the agencies of the health portfolio. Let me begin with the Canadian Food Inspection Agency. Overall, the estimates for this agency have decreased marginally over the last year. Beyond these estimates, Budget 2018 provides $47 million to maintain CFIA's efforts to improve food safety. Specifically, this funding will support activities to address food safety risks before Canadian consumers are affected. This includes improving risk intelligence and oversight, developing offshore prevention activities, and improving business compliance with food safety regulations. Budget 2018 also provides $29 million for continued support for CFIA's activities related to the negotiations of export conditions and the certification of Canadian exports against the import requirements of other countries. Je vais maintenant parler.
Let me now talk to you about the Public Health Agency of Canada. The main estimates 2018-19 for the agency calls for an increase of $17.2 million, which will bring their total budget to $589.2 million. This increase is mainly due to the creation of a fund for the reduction of harm reduction, which will support community projects to reduce the rate of infectious diseases such as HIV, Hep C, or other drug-related diseases. Also, the effects of climate change on public health. As you know, one of the government's priorities consists in understanding and minimizing the effects of climate change on health. This fund, which we seek in this budget, will deal with this priority.
Known as CIHR, supports world-class health research in Canada. CIHR's proposed spending on health research for 2018-2019 is approximately $1.1 billion, an increase of $16.8 million over the 2017-2018 main estimates. These estimates will help provide the evidence needed to make better healthcare decisions and ultimately improve the health outcomes for Canadians. By supporting the Canada 150 Research Chairs program, this funding will enhance Canada's performance and reputation as a global centre for science, research, and innovation excellence. In conclusion, en terminant, je tiens à vous dire que je suis convaincue.
I am quite confident that the measures I presented today will help the health portfolio or those responsible for it to fulfill their mandate and continue to improve the health of Canadians. This mandate is quite broad, and it will have to deal with a number of issues. So it is essential that we have our priorities well defined, aligned, assorted, and targeted. The expenses and engagements announced in our budget will deal with the most pressing priorities in matters of health. It is demonstrable proof that we are acting. It shows Canadians that we will continue to protect and improve our health system.
The committee for the opportunity to provide my comments, and I am pleased to take some of your questions. And once again, I have my officials with me, so if they get a bit technical, I may rely on them for a bit of assistance. Merci beaucoup. Thank you.
Oh, thank you very much. That's quite a list of issues you're dealing with. So amazing. So we'll go to our question period now. We'll start with Dr. Ayalson, 5 minutes.
All right. Thank you, Mr. Chair. Thank you, Minister, for coming before the committee at this early hour. We appreciate the accommodation. Now, as you know, we spent a lot of time over the past couple of years on preparing the report on pharmacare. And one of the biggest items in discussion is the numbers involved. Now, we had the Parliamentary Budget Officer report, and we had information from the Canadian Institutes of Health Research. I was concerned by some of the information in the dissenting report from the opposition party, claiming that it would be, according to Canadian Institutes of Health Research, that $39.8 billion a year is spent on prescription drugs. In fact, however, the more correct figure is this figure of $39.8 billion includes prescription and non-prescription drugs. And as we've said, we weren't thinking of non-prescription drugs being covered under a national pharmacare program, and that according to according to Canadian Institute for Health Information at committee, they said that public spending on prescription drugs accounts for roughly 43% totally of prescription drugs spending in Canada. So the total spending on prescription drugs, according to their testimony, was just over $29 billion as opposed to the $39.8 billion. This figure from the dissenting report, which appears has a lot of incorrect information, has that impacted any of your decision with implementing a pharmacare program or the advisory committee by Dr. Hoskins?
Thank you very much, Mr. Elson, for your question. As we've indicated very clearly, our government certainly recognizes that Canadians pay too much for drugs. And that's why that we were extremely pleased that in Budget 2018 that we saw the announcement that we were creating an advisory council on the implementation of a national pharmacare program. I also, first of all, want to take this opportunity to thank the HESA committee for the wonderful work that you've done and really looking at this issue, and you've done tremendous work in this area. And I have to say that the advisory council's probably first work that they're going to be doing is reviewing the report. I know that Dr. Hoskins has already done so, but we certainly want to make sure that the council builds on the good work that's already been started by this committee. We have made it very clear that we want Dr. Hoskins and the Advisory Council to prevent us with options with respect to a national pharmacare program and also with an implementation moving forward. So we have no preconceived ideas with respect to what this pharmacare program could potentially look like. And we certainly want to serve the needs of Canadians. As I've indicated, indicated, we recognize that Canadians pay too much for drugs, and we also recognize that many Canadians have to make choices between food and drugs or heating their home and drugs. Having been a frontline social worker for a number of years before I entered politics and working with many individuals that did not have access to a drug plan, I've certainly seen the realities firsthand. So as Canadians, we certainly know that Canadians are proud of their publicly funded healthcare system, but we certainly recognize that we can do better, and the implementation of a pharmacare program would certainly make things better for Canadians. I'm looking forward to the work that the Advisory Council is going to be doing, and looking forward to receiving the report by spring of 2019.
All right, thank you. Now, just to go on, further elaborate on this. Of course, there's sometimes a perception when this number of $33.9 billion a year going out. This gives the public perception that the federal government would somehow have to find an extra $33.9 billion a year. But again, according to our testimony as well, $12.9 billion a year is already being paid by provincial taxpayers through their different systems. There's also, from the PBO report, an additional savings of $4.5 billion just by a national drug buying program. A national pharmacare would also take care of, basically make obsolete a number of other expenses. Tax credits, if you're paying for medications, cost the federal government $2.5 billion a year. Which would likewise be unnecessary if people weren't paying for medications. What would be your comments on this being a much more sustainable type of program, given all these savings that have come out in the report?
Well, thank you once again for your question. Again, that is the reason why that we're putting in place an advisory council for them to really build on, as I've said, the work that this committee has done in order to provide us with information with respect to an implementation model. We also have to recognize that the Government of Canada has taken some steps to reduce the price of costs of drugs within this country. If I look at investments that have been made in Budget 2017, we invested over $140 million over 5 years to provide Health Canada agencies with respect to the tools that they need to reduce the price of drugs. We've also joined provinces and territories as members of the Pan-Canadian Pharmaceutical Alliance, where we've been able to bulk purchase drugs together in order to lower the price. And as a result of that, over the past year, jointly, we've saved approximately $1.3 billion, provinces, territories, and the federal government. So we are taking some steps to make sure that the prices of drugs certainly come down. And also, we're in the process of modernizing the Patented Medicine Price Review Board. So once again, we are doing some work before we look at a national pharmacare program, because we certainly want to make sure that it is going to be affordable, but also our priority is to make sure that drugs are affordable and accessible, for all Canadians. And that is truly why we're moving forward with respect to the steps that we've taken before, but also now looking forward to the work that is going to be done by the Advisory Council. I also have to say, with respect to the Advisory Council, we're just in the process of finalizing membership of the council members. I'm looking forward to being able to make those announcements in the very near future. But to look at the membership, the complement of the membership, we really want to make sure that we have individuals from different backgrounds in order to provide us with the proper information and the advice that we need for implementation.
Okay, thanks very much. And now we go to Ms. Gladue.
Thank you, Chair, and thank you to the Minister and her staff for appearing today. My first question I want to ask, in memory of the late Gord Brown, who passed away recently and who we all know was a passionate advocate for thalidomide survivors. In Budget 2018, the government committed to address these remaining thalidomide claims. Could the Minister update us on what action has been taken to resolve those?
Thank you very much, Ms. Gladue, and I really truly appreciate the question. When I became the health minister, I had the privilege and the opportunity to meet with some of the recognized victims of the thalidomide compensation package that was provided. And I certainly was able to see firsthand and to hear firsthand the challenges that these individuals have to go through day in and day out. So our heart certainly goes out to these survivors. And also I had the opportunity to meet with some individuals in my riding that were survivors or individuals that have not been named survivors, for the lack of a better word. So I was pleased that in Budget 2018 that there's been an amount of money that's been put forward in order to ensure that we can expand the eligibility criteria to the program. So we are in the process of working on that, and I'm truly looking forward within the next weeks, months to come in order to be making an announcement with respect to the next steps forward with respect to the expansion of the eligibility criteria with respect to that program.
Good. We hope to hear, how many people and how many are remaining and how many will actually receive their compensation. Second question I have is about palliative care because, as you know, I'm a passionate advocate for palliative care. And so I wondered how much is in this year's budget to address the need to have consistent access for palliative care for all Canadians.
Thank you very much. And once again, Ms. Gladdy, we were very pleased as a government in order to be able to support your bill, Bill C-277. And we're very keen in moving forward with respect to the implementation and the work that needs to be done in that area. We certainly recognize that all Canadians want to stay home as long as they can, but in order to do so, we certainly need to make sure that they have the quality care and the necessary care that they need in order to live the rest of their days in comfort. And those support services are absolutely critical. We are very pleased, as I've indicated, that we were able to support Bill C-277 and to work on the development of a framework that promotes palliative care. I was also very pleased that this year we were able to make some announcements, and I believe that you were with me at the funding announcement, $6 million to Pallium Services, Pallium Canada. And those monies were put in place in order to expand existing services, and they call it the Learning Essential Approach to Palliative Care Program. And that money is going to specifically go to frontline service providers like ambulance attendants or EMTs, and to provide them with the training that they need so that when they go to homes, especially in rural areas or people where they can provide direct services to people at home, they will be able to provide them with the additional services, quality services that people need so they won't have to be going to community centers or hospitals to receive the services that they need. So we're certainly moving forward in that direction and making sure that investments are made in that area. I was also pleased that we've put in place or invested $184.6 million over the next 5 years to improve home and palliative care for our Indigenous communities. We recognize that an awful lot of work needs to be done in that area, and we certainly recognize that those investments will certainly help moving forward. And finally, we recognize as well that research is key in this area. So we're investing over $2.8 million over the next 4 years to support 2 research teams, and I'm sure that you're probably well aware of that. But we certainly want to, generate high-quality research and evidence to inform professionals in healthcare with respect to best policies as we move forward in end-of-life care and the policies that we need to put in place moving forward. And finally, I also have, if I can, Mr. Chair, if I may as well, with respect to the investments that we've made in home care over in Budget 2017, we recognize that there's $6 billion that have been put aside, and I'm in the process right now of completing bilateral agreements with provinces and territories, and the ones that I've seen thus far, palliative care services are absolutely mentioned in those as well, so they may not be an aligned item in the budget, but we certainly know that provinces and territories, especially with our aging population, but also people want to make sure that they expand palliative care services, it's certainly a priority for them.
Excellent. I'll go
Do you
to
want
my
to split your time with Mr. Lobb? Mr. Lobb.
Thank you, Minister, for appearing. I have a document here. It's a request that Health Canada sent out its cost-benefit analysis survey that you've sent out to food processors. And in there, your department has asked, as per Treasury Board guidelines, to provide a cost-benefit analysis to which I think would amount to Bill S-228. In there, you're asking many, many questions that I think industry is very uncomfortable with, and one of them is costs do not include costs related to reformulating a food. And so I'm just curious, if you're asking industry to provide a cost-benefit analysis for marketing, et cetera, shouldn't the cost of reformulating their goods be also included in the cost-benefit analysis? My understanding is it's almost $2 billion to the industry for this, and I'm just wondering if you could provide some comment as to why your department would do this.
Well, first of all, I have to start off by indicating our healthy eating strategy was launched in 2016, which is a key.
I am aware of that. It's specifically to the cost-benefit analysis question.
With respect to the issue of marketing to kids, that is certainly a priority of our government that we've put it's one of our pillars when we look at our healthy eating strategy. I would be more than happy to ask one of my officials to perhaps provide a bit more information with respect to that, with respect to the details. So perhaps.
Sure. The Treasury Board sets out fairly detailed guidance on how these cost-benefit assessments are to be
Specifically,
conducted.
though, about the reformulating, because that is going to be a massive cost industry.
My sense has been that, and I'd have to get back to the committee formally, but that the decision of whether or not to reformulate in order to avoid the restrictions is a business decision. There's no requirement in the new marketing rules that would require a business to reformulate. That's entirely a decision that's within the discretion of the management of the firm. And so that's not a cost that you can calculate as part of the cost-benefit analysis.
So if you change the rules that a company manufactures food and
just Mr. Chair, the rules are not with respect to the formulation of the food. The rules are with respect to what can and can't be marketed. So if a firm decides that it wishes to reformulate its product so that it can continue to market, that's a business decision. That's not a requirement of the regulations.
Okay, we have to move on to Mr. Davies now.
Thank you, Mr. Chair. Thank you, Minister. Thank you to the staff for being here at this early hour. Minister, of course, you know, after 2 years of study and hearing from almost 100 witnesses and over 30 written submissions, this committee released our final report called PharmaCare Now, Prescription Medicine Coverage for All Canadians on April 18th. And after consideration of many different policy proposals, this committee concluded that the best way to move forward is by expanding the Canada Health Act to include prescription drugs dispensed outside hospitals as an insured service under the Act. In other words, to make pharmaceuticals part of our single-payer public system. That was the considered recommendation after 2 years of study of this committee. As Health Minister, I'm interested, do you agree with that recommendation?
Thank you so much, Mr. Davies, for your question. And as I've indicated, we recognize that Canadians pay way too much for drugs, and that's why that we are moving forward with the implementation of the Advisory Council and the implementation of PharmaCare. We recognize that Dr. Eric Hoskins is very well positioned in order to chair this committee, and we've instructed him that we want to make sure that he presents us with options regarding a national PharmaCare program, what that could look like. We have no preconceived ideas as to what that is going to be. I have no preconceived idea as well, but we certainly want him to come forward and the council to come forward with options, but also the implementation on the way forward, because we recognize that having 13 provinces and territories being a member of a federation, we certainly want to make sure that we get this right. And with respect to our council members and also our chair, having been the former health minister of one of our major provinces, he certainly recognizes the challenges that we could meet going forward. So we certainly want to position the council to provide us with that information that we need with respect to the implementation plan. And we don't want to wait. We want to make sure that the committee gets out there. And I have to say that Dr. Hoskins already, our board members, as I've indicated, I'm hoping to be able to make the announcements in the very, very near future. But Dr. Hoskins himself has already been in the process of meeting with provincial and territorial health ministers.
Time. I mean, my question was what you think. My question was what your opinion is. Do you agree? There's different ideas. And I'll turn to another idea. Your colleague, the Finance Minister, Mr. Morneau, less than 24 hours after announcing the Federal Advisory Council on PharmaCare, rushed to clarify that he isn't looking at implementing a universal PharmaCare plan, but rather a, quote, fill-the-gap strategy. By the way, exactly the strategy this committee recommended not to pursue. Here's what he said, quote, "So you said a national PharmaCare strategy, not a national PharmaCare plan. Those are two very different things. We recognize that we need a strategy to deal with the fact that not everyone has access. And we need to do it in a way that's responsible, that deals with the gaps, but doesn't throw out the system that we currently have." So my question, Minister, is, you have one of your colleagues who very clearly is rejecting a single-payer universal system in favor of one that is a gap-filling. And I'm curious, as Health Minister, shouldn't you have a position on this? Shouldn't you be telling Canadians what your view is, what you're fighting for at the Cabinet table?
I am going to be very clear that I'm encouraging our Advisory Council to continue to have a national dialogue with Canadians and experts in this field. I've made it very clear that I have no preconceived idea as to what the outcomes of these options are going to be presented, but I'm going to be very clear. we have made it very clear from the onset that there is no preferred option that we are looking at right now. We want the Advisory Council to provide us with the work, and we also want the Advisory Council to build on the good work that this committee has done. And I say that, you know, very honestly. I recognize that this committee has done tremendous work over the past year.
Appreciate that.
We certainly want the Advisory Council to build on that work as we move forward.
Thank you. I want to move to opioids because you made a reference to it. Minister, we just had in British Columbia overdose deaths spiked again in March, reaching the province's second highest monthly total to date, according to the BC Coroner Service. That is the second highest month ever recorded on record, second only to December of 2016. And we know that last year over 4,000 Canadians lost their lives. Some estimate that we're on track to exceed that, maybe as many as 6,000 Canadians dying from overdoses this year. Now, at the Liberal Party's convention in Halifax this year, your party's grassroots voted overwhelmingly in favor of decriminalization and medical regulation as a means of responding to drug overdose deaths. In response, a coalition of 200 organizations, researchers, policy experts, including former Liberal leader Bob Rae, and others impacted by the opioid crisis, wrote your government an open letter urging you to, and I'm going to quote, be the progressive government you promised to be, choosing human rights and evidence-based policy over ideological relics. We need you to listen to our voices as we call for the essential next step, decriminalization. The example of Portugal and other European countries illustrate that this policy works. We ask you to prevent thousands of more unnecessary deaths by supporting this resolution. However, you and the Prime Minister have both responded unequivocally ruling out acting on that resolution. So, Minister, given the severity of the opioid crisis, given that we expect as many or more deaths this year as any other, why won't your government even consider the evidence-based proposal of decriminalization and medical regulation of drugs?
I've made it very clear at the many events and committee appearances that I've made that the opioid crisis is a file that we certainly have been doing a lot of work, and a file that keeps me up at night. I've indicated in my opening statements that my first tour that I did, my first visit that I did, was in the downtown east side in Vancouver, and had an opportunity to meet with many frontline service providers and many people with lived experience that shared with me differing points of views. With respect to decriminalization, with respect to your question specifically, we recognize that decriminalization alone would not ensure quality control of drugs on the street. It certainly is not going to prevent all of the deaths that are happening. We also recognize that when we look at the Portugal model is very different than the Canadian model. We recognize that in Canada, provinces and territories are the ones that provide direct services to clients. And with respect to the federal government, we are not the ones that provide the direct service delivery. As a result, our government has taken a comprehensive, compassionate, and a collaborative approach working with provinces and territories, and we are using all the tools at our disposal to ensure that we can provide compassionate care to services. We've also made, and as you're well aware, we've made several regulatory changes to ensure that we could ensure that medication replacement therapies are available for individuals. This year alone, we've made methadone available without doctors having to apply for class exemptions, and also diacetyl morphine. So we are certainly moving forward in ensuring that we can use all the levers that we have at our disposal to effectively deal with this. The other thing
I have to end that now. I find that all the questions are long and all the answers are quite long, so I just caution you, if we could tighten up the questions and tighten up the answers, we could get more questions than answers, but we have to move now to Mr. Oliver for 5 minutes.
Thank you very much. Thank you very much, Minister, for being here. You've had a number of questions about National Pharmacare, and I just want to say that's certainly one of my passions. For me, it's quite simple. No Canadian should be denied access to necessary prescription medicines because they can't afford it, and we need to find a solution to that. One of the reasons I entered the political sphere was to fight for this. And I was delighted as a member of this committee. I introduced the topic to the committee back when we first started as a study topic, and I was delighted, absolutely delighted that every single member of the committee, there was no motion, no member actually came forward with a motion. It was a unanimous decision of all the committee members to undertake this study. So I was really honored and delighted to see that happen. So I just want to emphasize the importance of pharmacare. I know Dr. Hoskins is studying implementation of national pharmacare. Our study talks about universal pharmacare. To me, these are the same words describing a system of universal single-payer coverage for all Canadians. There is a lot of pressure coming from insurance companies and drug companies that they're more interested in different solutions, like regulating the industry to ensure that all Canadians are covered. And it leaves many of the fundamental weaknesses in the system in place. So can you comment a bit more on the lines of Mr. Davies' questions around, do you really see a situation where we would just be regulating that sector, or do you really feel we were looking at implementing of a national pharmacare system or a universal pharmacare system?
Well, just to reiterate, I guess, a bit of my comments as I've indicated, we have no preconceived notion of what a national pharmacare program can look like. And we've made that very clear with respect to the terms of reference that we've provided to Dr. Hoskins and the future committee members. We've made it clear, and Dr. Hoskins has been reading your report that you've presented, that you've tabled. He's already read it cover to cover. And we certainly want to make sure, and he's made it clear, that they are going to build on the good work that has been done here. So with respect to that, we certainly want to make sure that Canadians have access to prescription medication. And again, we, at this point for the past few years, we've taken some measures to ensure that we can lower the price of drugs. And that's the responsible thing to do.
Absolutely.
Moving forward. And now we're looking forward to the
My second question is on a different area. So I chair the Health Research Caucus, and in my prior life, I sat on one of the CIHR allocation committees, and I saw the struggle that was happening with the health research community, particularly with the cuts that happened under the previous government to health research. So I was delighted to see the investment in 2018 in funding for CIHR. You mentioned it in your opening remarks. Can you talk a bit more about how you see the advantages of that? Of those investments to health research across Canada?
Absolutely. Thank you so much. And I think all of us in this room can certainly agree that when we're developing good public policy, we certainly need to make sure that we can rely on science, good research, and also good data. And our government has certainly been very clear that we believe in investing in people behind the next big ideas, and we certainly want to make sure that the appropriate investments are there in order for them to continue to do the good work that needs to get done. Dr. Naylor was very clear in his report that he tabled, indicating that with respect to the funding that was needed, he certainly did not shy away from that. So I was very pleased to see that in Budget 2018 that we made historic investments in science and research. And I can tell you over the past number of months when I've been visiting different researchers, people are certainly applauding the investments that have been made. So when we look at investments in Budget 2018, with respect to CIHR and the investments there, we certainly recognize that the investments that have been made includes $454.7 million over the next 5 years, $90.1 million per year ongoing for the Canadian Health Research to increase its support for fundamental research. So with respect to that, we certainly recognize that a lot of work needs to be done in order to support the current generation of researchers, but also encouraging the future generation of researchers. So we certainly recognize that significant investments have been made.
There was an excellent session held by ovarian cancer. They're a bit worried that they're not going to line up properly with that funding. So if I could just ask you through this forum, if you could give special consideration to ovarian cancer and ensuring we get some federal funding to support ovarian cancer research.
If I may just comment on that, I did have the opportunity this week when they were on the Hill to meet with them, and we had a very good conversation and exchange. So I've certainly asked my staff to follow up with respect to their agency and the work that they do.
It's such a high mortality rate, and it's from a gender lens of the research allocations. I really do hope we can focus in on that one a bit somehow. I know it's a tough one, so thank you.
I was second too, so now we're going to go to Ms. Sidhu for 4 minutes.
Thank you, Chair. Thank you, Minister, and your department for being here today. And I want to echo Mr. Oliver's comment. Yes, thank you for taking a leadership to giving more funding to research, but we always need more ovarian cancer. We need to look into that. My question is, 2 weeks ago, MP Mark Surrey and myself did a town hall, seniors did them in my riding, and there's a lot of concerns from seniors in my riding I heard So what are your department is doing to help seniors? Can you explain that? Seniors are having more challenges they are facing. So what your department are doing to help seniors?
Thank you so much, Ms. Sidhu, for your question and for your work, and also for Mark Setty's work in the issue of seniors. I certainly recognize it's a passion of his as well. Our government certainly recognizes that seniors is one of the fastest growing populations in our country. And coming from New Brunswick, actually, when we look at our demographics, New Brunswick has the oldest population in the country. And with that comes opportunities, but also certainly some challenges as well. In Budget 2017, we were very pleased that we were able to invest, as we are aware, $6 billion in the area of home care and also palliative care services, but also in the area of mental health care as well, an additional $5 billion. And we certainly can't forget that many of our seniors as well need access to mental health services as well. When we look at the rates of services or the rates of mental health issues is about 1 in 4 in seniors as well. But coming back to the home care, we certainly recognize that seniors want to stay home as long as possible. So it's truly important to make sure that we don't only invest in bricks and mortars and buildings and nursing homes, but we also have to look at different service delivery models in order to provide the seniors with perhaps the additional support that they need to stay in their homes even longer. So I'm very pleased that provinces and territories had agreed to a common statement of principle with respect to where that money would be invested. And we've been able to successfully negotiate several bilateral agreements with provinces and territories with respect to where those monies are going to be going. So that's number one. We're also in Budget 2018, I was pleased that a $75 million amount was put aside for a pilot project to look at aging as well, and investments are going to be made in that area to look at different models in order to transfer those types of models possibly to other provinces as well. And finally, I wanted to add, through the Public Health Agency of Canada, they have put in place, or they've developed, I guess, some guides and tools in order to allow cities to put in place age-friendly cities for their seniors. I know for my city in Moncton, New Brunswick, I'm very proud to say that we are an age-friendly city. But things that they've done, they've provided information with municipalities or towns and cities, kind of what can they do to make their city more, age-friendly? Is it buzzers on the door, making sure that your sidewalks don't have big lips on it, or whatever the case may be? So those are some really neat initiatives that Health Canada or Public Health has done moving forward. And finally, as well, I also have to add that Public Health does some work as well in the area of data collection, in the area of elder abuse. Oftentimes, that's not an area that we speak about an awful lot, but we certainly recognize that the rates are high. But we certainly need to have a better picture of exactly what that looks like. So Public Health is certainly collecting data and finding ways to better address the issue of elder abuse. And finally, as I've indicated, with respect to mental health, we want to make sure that services are in place, so targeted funding has been put there. And also, we certainly can't forget the area of health research. So we look at funding that has been put forward through CIHR and other groups with respect to brain health initiatives and the rest of it. Significant investments have been made in that area because we certainly recognize that our population is growing older, and we certainly have to make sure that we understand the challenges of today, but also the challenges of tomorrow.
Sorry, we have to move on now.
Okay.
So we're going to start our 5-minute round now with Mr. Weber.
Well, thank you, Mr. Chair, and thank you, Minister, and all for being here today. I'm going to ask you again, Minister, some questions on Lyme disease. And we already know about the 3 pillars and the conference and the framework that was developed a couple of years ago. So please do not use up our time with the information on that. My questions, again, regarding the 3 pillars of surveillance, education and awareness, and guidelines and best practices, the 3 pillars, but there is no 4th pillar, Minister, and that is support, help, and treatment for those already suffering from Lyme disease. Now, Minister, the Liberal government spent twice as much money on the temporary hockey rink outside here, outside Parliament, than they did on Lyme disease research. There is no support for Lyme patients. So, Minister, what are you doing? Why is there no help for the thousands of Canadians suffering from Lyme disease today?
Well, thank you very much for your question. And we certainly recognize that Lyme disease is a public health concern in Canada, and we are taking action on it. You perhaps don't want me to mention the steps that we've taken thus far, but I certainly want to reiterate that there's a lot of, there certainly has been some work, and there continues to be research in this area. If we look at the area of the Infectious Disease and Climate Change Fund, that's a $21 million fund that's been set aside over the next 11 years in order to address the impact of vector-borne, waterborne, and food-borne infection diseases like Lyme disease. And so far, actually, out of that fund, $1.4 million has supported 7 research projects in the area.
And that, Minister, I understand the research and the money that's being put into research, the $4 million. You've indicated that to me in question period. Now, Minister, Lyme disease is, as you know, a very growing problem here in Canada. A full 20% of the ticks out there right now are carrying Lyme disease. There are now 10 times as many known cases of Lyme disease than there was back in 2009. Now, Minister, your own public health agency says that known Lyme cases are up 50% from the last summer. A 50% increase in 1 year, and that's a cause for great concern. So with Lyme cases up by 50% in 1 year, one would expect that funding would also increase by at least by that much, if not more. With the problem up 50%, how much has government spending increased on treatment for patients of Lyme disease?
Thank you once again. As you're very well aware, the direct treatment delivery model is provided by provinces and territories, and we provide funding with respect to our health transfer payments with respect to that. But with respect to the work that is being done, we are absolutely supporting provinces and territories through our federal laboratories to make sure that the detection of Lyme disease does occur. As well, we certainly want to make sure that public information and awareness campaigns, we certainly have a huge role to play in that area. And I'm very pleased to say that actually for the launch of the 2018 campaign, it's just been launched last month, and information with respect to Lyme disease, because we recognize that spring is here now, we certainly want to make sure that Canadians have access to the information. And through an online distribution and also through Service Canada and Parks Canada, a lot of information has been distributed. But I may ask my public health officer if there's any more information that she wanted to add on that, if you would permit her to.
I would just like to know what we are doing for the Lyme patients who are suffering right now, who have been forgotten in this country. There is no treatment for them, and we need to address their huge problem. We've met with you numerous times. The Lyme groups have met with your staff, and there just doesn't seem to be anything that you are doing for these patients. So, you know, I guess a quick question that I have is, you know, of this $4 million that you did allocate last year for Lyme disease research, you know, how much remains unspent of that $4 million? Could you answer that one?
I'm going to refer that to my public health officer.
Yes, so there's different buckets of funding, if you like. The $4 million for the research network is still at play, so that discussion on how that spending is going to be done is currently being reviewed and evaluated. That's for our research network. Of the funding that we received in the Pan-Canadian Framework on Clean Growth and Climate Change, there were $20.8 million over 11 years for specific projects that can be played out in the community. So we actually just gone through phase 1 of that funding approach, and we'll be launching more requests for proposals in the future. And as the Minister mentioned, of the 13 projects that we've already considered, 7 are focused on Lyme disease.
Focused on the patient.
Sorry, time's up. No, we're beyond now. So, we have to move on to Mr. Ayoub.
Merci, Monsieur le Président. Merci, Madame la Ministre.
Thank you, Mr. Chairman. Thank you, Madam Minister. You have a department and we have a committee which are quite extraordinary because we are dealing with issues that are vital to Canadian interests. And on a daily basis, we've done a number of studies on these issues, of course, and health of Canadians. I'd like to hear a little further from you as to organ donation. I'm quite taken by the subject over the last few months. I've made some inquiries as to my co-citizens, as to their interests and their concerns and their thoughts about it. The reaction was instantaneous, and 90% of people who responded are in favor. 20%, however, is the participation rate. You know, those people who sign the organ donor cards. So the challenges are fairly significant for those who are waiting an organ. 250 individuals of 4,600 on a waiting list. 250 of these people die every year waiting for an organ. What initiatives has your department taken, pan-Canadian efforts, because of course there's got to be provincial involvement, but what initiatives have you taken, and what are we going to do for the future to improve this situation? Thank you, Mr. Ayoub. Our government, of course, recognizes the significance and the importance of organ donation in Canada. Personally, I am quite fascinated by that whole issue. We have a close friend who went through a transplant just quite recently, and he's reborn. He has a whole life ahead of him now, so that's great. Since 2008, provincial governments have been making significant investments in this area. The Canadian Society, the Canadian Blood Services, for example, over $9 million to support the blood services. We want to help this association to coordinate the various organ and tissue donations. We've invested $100 million for research between 2012-2017 to ensure that we can better understand the situation, the issues involved, and the complexities and the challenges. We continue to work, of course, with provinces and territories to coordinate an approach which would be valid throughout Canada. We realize we have to work in cooperation with the provinces and territories if we're to attain a better strategy and a better plan for all Canadians. Well, thank you for that answer. We see that there's a lot of efforts that have been made, but there's still a lot of progress to go. I think we can go quite a bit further on this. So I'm going to introduce a motion, M189, so that we can improve the quality of life for Canadians who are suffering for lack of, they could improve their life conditions with a donation of an organ. So I thank you for your answer, but perhaps with the motion that I'll be putting forward, we might see some further action from your department. Another important issue that arose in Quebec quite recently, but which has impact throughout the country. Antonin Gervais lost her life, unfortunately, and we tried to take a look at these high alcoholic power drinks that are on the market. We met with a number of witnesses before our committee, and the availability of these drinks seems to be a fairly significant issue. They're readily available, they're visible on the shelf, and young people can have access to them or shoplift them without much control. What's the government doing to try to reassure the population that we're looking out for the safety of our youngsters? Well, thank you for the question. The work that your committee has done on this issue is fantastic. The Madame Gervais family, one death is one death too many, and this leads us to quite a bit of concern for this issue. And for that reason, we acted immediately. We asked to ensure we're going to publish and mark a notice of intent to change the law or the regs so that we can control the limit of alcohol content in these sweetened drinks. We're working, of course, with provinces and territories because alcohol regulation, of course, is a joint effort. We've already called for a teleconference with the provinces to continue the conversation. Let me be clear. These drinks, as they existed at that time, will no longer be permitted. The alcohol level will be reduced, or at least they'll change the container, and we will do everything possible to avoid a repeat of the situation.
Thank you, Chair. So my first question has to do with the new drug approval process. I was at a forum with McDonald Laurier where there was a lot of stakeholders, industry, academia, policy people talking about the PMPRB changes and indicating that they will have huge unintended consequences, that they will likely eliminate clinical trials in Canada, that many companies will decide not to market new medicines to Canada because this process is actually, the changes are going to make it longer and more expensive for people to bring drugs here. So I see that there's money allocated in the estimates for changing this process. Will the minister consider abandoning these changes based on all the input from the industry, academia, policy, and other stakeholders?
Well, thank you very much, Ms. Gladue, for the question. I think that we all recognize, and when we look at the prices of drugs, I've indicated a few times today, we certainly need to do all that we can to bring the prices of drugs down. And that's why that we're in the process of modernizing the patented PMPRB. We've met, our officials have met with several individuals in this area, and they've shared with us their points of views. In the issue of the area of research, we recognize that there's different ways that we can fund research as well. So we are looking at all options, but at the end of the day, we certainly want to make sure that as government, that we update the regulations, and we certainly have to look at doing things differently. PMPRB has not been updated, I believe it's been in 20 years. Or even longer. So we certainly recognize that we have to do some work in that area, and we're looking forward in having consultations, and we continue to have an open dialogue with those involved. And perhaps my Deputy Minister would like to add a few comments with respect to that.
Maybe just one thing, Mr. Chair. One thing that has received perhaps a little less attention than the proposed regulatory reforms to the Patent and Medicine Prices Review Board is significant changes that are happening in the health portfolio around how drugs are reviewed and approved. And a key objective is actually to streamline and make it faster for valuable new medicines to get to market. And we're actually working quite closely with the industry on that. So I'll just give you an example. We want to provide new pathways to market that might rely more extensively on reviews that take place in other jurisdictions. So if a new drug comes out and it's clear that it has tremendous benefits for patients, maybe it saves the health system money. If our major partners abroad have already reviewed and approved it, we're looking at whether we could use that as a basis to actually expedite getting it to market. And I would say the industry are very interested in some of these new regulatory pathways. So while pricing obviously is something that is getting a lot of attention, and understandably, there's a lot of other things we're doing to try to actually make it easier and faster for valuable medication to make it onto the Canadian market.
I do think it needs to be faster, and I do think we need to make sure that we're continuing to have access to new medications. I heard the same concern about the medical devices single access program, that actually, especially the regulatory burden that this will put on smaller entrepreneurs that are introducing medical devices into Canada, that this may limit the number of new devices that we would see. So if you could comment on how you might be able to change that process to not put such regulatory burden on small companies.
So just very briefly, Mr. Chair, on the medical device single audit process, there has been, I think, a little bit of confusion around this. So Canada actually has a mandatory system for these kinds of audits, and so the updated process will be mandatory, but the old process was mandatory as well. So we're not, the government is not kind of imposing something that was not a requirement all along. The new system is one where the audit process is going to mimic those in a number of our major trading partners, and larger manufacturers of medical devices have actually said that they value this because once they get an approval in Canada, that approval will actually be valid in a number of other jurisdictions. So we're kind of taking a process that used to be Canada specific, and we're now making it such that if you get an approval, it'll actually be something that you can then use in other jurisdictions. So for certain firms, it's actually kind of a reduction of red tape. We have heard from SMEs and others concerns that the new process is more complex, and I would just indicate to the committee, Health Canada is very sympathetic to those concerns. We are quite keen on addressing them. The intention here is to introduce a program that will be of value, and so we're actually in active conversation with SMEs and others to see how we might make adjustments.
Good,
We have to go to Mr. McKinnon now.
Oh, darn.
Thank you, Chair, and thank you, Minister, for being here. I'm going to switch gears here and talk about antimicrobial resistance. As you may recall, this committee did a study on antimicrobial resistance, and we released a report quite recently. The prevalence of microbes that are becoming resistant to our pharmaceuticals, our antibiotics, is a major issue. It's an emerging issue around the world. And effective antibiotics are critical to much of modern medicine, such as major surgeries, for example. One of our recommendations was for a national surveillance system. And in fact, I had recently a delegation in my office from some healthcare agencies who are asking specifically for that. So I'm wondering if you can speak to any actions that might be underway towards a national surveillance system for antimicrobial resistance, and also I'm interested in whether there are incentives available and perhaps research money for the development of new vaccines, which is becoming ever more critical as we go forward. Thank you.
Thank you so much for your question. And I also want to again thank the committee for the work that you've done on the issue of AMR, and we certainly look forward to responding to your recommendations very soon. Again, we recognize that antimicrobial resistance is an absolute global health issue. I can say that every international meeting that I've attended, the issue of AMR comes up with all health ministers, so it's certainly an area of top priority for all levels of government, both here in Canada, but also abroad. Also, we've certainly made some investments with respect to the global health issue. $9 million has been set aside or has been invested to support global efforts in the issue or in the area of antimicrobial resistance. We're also investing approximately $107 million for research and innovation in Canada on this really important issue. And it's really important that we want to understand the challenges, but also we want to look at how can we address these challenges. So significant monies have been put aside in that area as well. And finally, as the federal government, we are certainly taking a leadership role in working with provinces and territories in this area. But presently, work is underway in developing an action plan to identify concrete deliverables as to how to effectively deal with AMR in Canada and also abroad. So it's certainly a very active file, and it's certainly one that is absolutely a priority for our government. And I know that Dr. Tam and her colleagues internationally, it's certainly one that's top of the agenda at every health meeting that we do attend.
Great. I had a number of questions about opioids, but I think that's been very thoroughly covered, so that'll be my questions.
Actually, we've exhausted our time, and I know some of the members have other committees at 8:30, so I'm going to have to call into it. I'm sorry, Mr. Davies, we're not going to get to your question. I really am sorry, and I know it would be a good question. But one thing I want to mention is, Minister, you mentioned the PharmaCare report a couple of times and the quality of it, and I would like to give the credit for the quality of it to our analysts and researchers. To me, we had 130 presentations altogether, and I thought that report was just excellent, the way it reflected everything that we heard and we felt, and so I give them credit for this. Again, Mr. Davies, I'm sorry, but we're just out of time. There's another committee coming in here too. We have to vacate. I'll make it up to you somehow. Thank you very much, Minister and officials, for coming. Meeting adjourned.